Who can you believe we're here? Week 13. You have officially crossed the finish line of the first trimester and entered the second. Everyone talks about this being the honeymoon phase of pregnancy, and while my energy is definitely making a comeback and the nausea has mostly packed its bags, a few other weird symptoms have shown up to the party. So today, we're getting into what's really happening at 13 weeks, what our little peach-sized baby is up to, and the must-know info to help you rock this new trimester. Introduction. Hello and welcome. Honestly, reaching this milestone just feels huge. The risk of miscarriage drops quite a bit, and for a lot of us, that bone-deep exhaustion and morning sickness from the first trimester finally start to chill out. It's a time when you can actually start to enjoy being pregnant. This week, we're talking about all the incredible things happening with your body and your baby, from the amazing developmental leaps they're making to the symptoms that might have caught you off guard. Section 1. Your peak-sized baby's development. Alright, let's start with the star of the show, your baby. At 13 weeks, your baby is about the size of a peach or a lemon, which is roughly 3 inches long. It's wild to think they're that small, but the amount of stuff happening in there is just mind-blowing. One of the coolest things is that their vocal cords are developing this week, getting ready for that very first cry. Their body is now fully formed, and they are wiggling around like crazy, even though you can't feel it yet. They're able to move their arms, make a little fist, and might even be sucking their thumb, which is practicing the sucking reflex they'll need for feeding. Internally, their organs are maturing and really starting to work. The liver and pancreas are now functioning, and their kidneys are producing urine. Their bones are also beginning to harden, especially in their head, arms, and legs. And get this, your baby's unique, tiny fingerprints are starting to form on their fingertips. Their head is still pretty big compared to the rest of their body, about a third of their total size, but their proportions are slowly starting to even out. Section 2. Mom's symptoms and body changes. Okay, so what about you? The second trimester often comes with a welcome wave of energy and way less nausea. But just as some symptoms fade, new ones can pop up, and a few old friends might decide to stick around. One of the big surprises for many is round ligament pain. This feels like a sharp, sudden twinge in your lower belly or groin area. It's totally normal, and it's just caused by the ligaments that support your growing uterus stretching out, but, wow, it can definitely make you jump the first time you feel it. Headaches can also be a thing in the second trimester, mostly thanks to hormones and increased blood volume. I've definitely had a couple this week. And don't be shocked if your digestion is still a little off. Heartburn and constipation are super common as pregnancy hormones slow the whole system down. On the outside, you might be noticing some changes to your skin. Some women get that legendary pregnancy glow from all the extra blood circulation. Others might deal with greasier skin or see some dark patches, which is known as chloasma or the mask of pregnancy. And a little TMI, but you might also see a thin, milky vaginal discharge called leukorrhea. It's perfectly normal and is actually your body's way of protecting against infection. Section 3. Essential tips for week 13. So, how do we deal with all this? Let's talk strategy. First, to handle the digestive weirdness, try eating smaller, more frequent meals. Loading up on high-fiber foods, think whole grains, fruits, and veggies, and drinking tons of water can really help get things moving. Second, since you might actually have the energy to move again, this is a perfect time for some gentle exercise. Things like walking, swimming, or prenatal yoga are amazing for boosting your mood and can help with annoying back pain. This is also the ideal time to start doing your pelvic floor exercises, or Kegels. Strengthening these muscles now is a huge help in preventing incontinence later on and makes for a better postpartum recovery. And third, Take care of your skin and your gums. Swollen and bleeding gums are a surprisingly common pregnancy perk, so use a soft toothbrush and be gentle. If you've been dealing with morning sickness, try to rinse your mouth with water after you get sick to protect your teeth from stomach acid. And for that growing belly, a good moisturizer can help with any itchiness as your skin stretches. Personal journey for me, the biggest change this week has been my wardrobe. My pants have officially betrayed me. Nothing with a real waistband is comfortable anymore, so I am living in leggings and maternity pants now. This is also the first week where I feel like I'm sporting a tiny, definite bump, not just bloat. It's all starting to feel so much more real. CTA and AMP. Conclusion, and that's the scoop on week 13. It really feels like a turning point as we head into the second trimester. I hope you're starting to feel some relief from those early symptoms and getting excited for the months to come. I would love for this to be a place where we can all connect, so please drop a comment below and tell me what symptoms you are experiencing this week. It's so helpful to know we aren't the only ones going through it. And if you want to follow my journey, make sure to subscribe and hit the notification bell so you don't miss the week 14 update. Have a wonderful week, and I'll see you in the next one.